Thank you for that lovely introduction. I'm humbled. Thank you. I'm glad you're here today because you're going to give me something that's to present to you that is very dear and very sacred to my heart. And it's on the relationship of long-term care, dementia patients in nursing home settings. And a lot of times we don't address the spirituality issue because we have not thought about it. What got me on this road is very precarious because a patient was dying with me and he asked me a question. And he said to me, what is the difference between religion and spirituality? And I really had a hard time trying to meet his needs and trying to say to him, what is your view of it? It's important for me to know what your view is and how this relationship is with you. So it sent me on a journey of research, and from this research is this presentation that I'm about to present to you, because it's all about feelings and understanding about what the needs are of patients in a nursing home setting that are dying, have no will to live any longer, and are very lonely. So with this, I want to show you some things that was a revelation to me and also in research and understanding. So here we go, okay? Actually, aging is not a disease. I think that might be a surprise to some of you because it was a surprise to me. It makes the body more vulnerable to disease. And dementia is a physically based disease affecting the brain cell function. So it's really a deterioration of the brain caused by a disease process as you age. Lucille Ball, I thought she's also one of my passionate people that has a sense of humor. She once said, the secret to staying alive and young is to live honestly, eat slowly, and lie about your age. And I love that concept. Gifts of aging. Now, there is a positive side to aging, and I can really relate to this because it's a view from the top. You've done it all, you're here, and you're really an expert in living and experience. And your experiences, we lose a lot of that, and I wish more people would publish their experiences because it gives us a view of many things and many opportunities to learn from the aging population. They have a wealth of information. Encouraging others in volunteering, I do that myself right now in parish nursing. I do a lot of visitations to nursing homes and hospitals, and it gives me some satisfaction when I volunteer my time because I understand what the needs are. Spirituality maturity, you'll get some spiritual maturity because you understand yourself when you get to this point in life. You know what the values are in your life. You know what means more to you than anything. You know what makes you happy. And at this point, that's self-actualization, really. Understanding yourself, knowing yourself. A lot of people never gain that self-actualization. They're still my son always, I'm finding myself, Mother. I'm finding myself. I said, I wish you'd find yourself. It would be nice. You don't need an outside approval to know who you are and if you're acceptable. And that gives you some self-satisfaction in who you are and how you promote yourself in your life. Our core identity changes, and it changes over life because of our experiences, deeper and with more wisdom. And we have more time to spend with our family and friends, and I'm spoiling my grandchildren rotten, and I love every minute of it. Best evidence on aging. This is out of our research. Our bodies reach a maximum capacity probably during early adulthood, and then we slowly start to decline after that. That's what the research is showing right now. Age does not occur on a specific timetable. Everyone ages differently, and that's really your biology and your gene structure on that. Healthfulness and dependency are not a characteristic of old age, believe it or not. Some 87% of older adults maintain a good lifestyle. I have friends, I went to the pool the other day and I did my aerobic swimming. I think it's aerobic swimming. I do a couple laps. There was a 98-year-old woman in my next lane that beat me by 10 laps. So it's not all about aging. She says, you're so slow today. I says, you make me feel terrible. You're 98 years old and you can beat me at anything. It's all in the mind, she says, all in the mind. There's no cure for aging. It's not beauty in a bottle either. Believe me, I know that. Okay, dementia. We're going to talk a little bit about dementia because that's where a lot of people don't understand the different causes. There's a different pathology for each type of dementia, and there's really over 50 different types. We're only going to talk about the top 3 today. But the different types of dementia are caused by different parts of the brain not functioning, damage to that brain part, and also it's a different pathology, if you know it. I don't know if you realize that or not, but there's a lot of different pathology with dementia. Dementia is Latin, and it means from the mind. That's a Latin term, and it means that something is not working cognitively or physically or probably how well you can live and do your work, like eating, walking, bathing. All those are part of the decline process. There's 3 main symptoms. It's progressive of 2 or more impairments of mental skills, and that's interfering with a person's ability to function. So when we look at those 3 categories of activities, behaviors, and cognition, these are what we look for when we see dementia starting. And we have to look at those areas to decide if this is truly a dementia patient because there's different types. The disease process starts slowly, and you'll see this in the pathology soon because it erodes different areas of the brain at different types of dementia as they start, and it affects only certain areas of the brain. In Alzheimer's, it affects the whole global issue of the brain. So it starts in small parts, and then it slowly evades the whole system and also the central nervous system. Each type of dementia starts with a specific part of the brain. Some dementias can be reversed, and we'll go over those on the next slide. As long as only one symptom exists, then it's called mild cognitive impairment. That's the clinical diagnosis if only one symptom exists. That may be you're forgetful or you have trouble with just one thing. You may be just forgetful, but nothing else is wrong. Like you can do your activities of daily living, of bathing, of eating, and dressing, and that you are also being able to communicate with people, and you have a good gait. And these are things that we look at when we diagnose dementia and where they are in the stages of it. The causes of dementia. These are probably the top, I would say, 6 or 7 causes. And there's many more, but I wanted just to give you the top 6. The metabolic disorders like thyroid problems, hypoglycemia, these cause brain damage. Trauma, a subdural hematoma. I used to be a neural nurse, and I saw a lot of trauma and subdural hematomas, a lot of brain damage with that, even with younger people. And you come out with a brain damaged, smaller cognition focus. And with that, there's teenagers that are in trauma dementia. And I've took care of several of those, and they do very well, but they have some trauma to the brain. Also, nutritional deficiencies, like vitamin B12. We have to look at those B12 levels, B6 levels, B12s. Severe dehydration can cause nutritional deficiencies. Disease like a stroke, anemia, heart attacks, and asthma can cause these problems because of lack of oxygen to the brain. That can cause some brain damage. My aunt was 84, and if I hadn't saw her have a stroke in the middle, I would have never believed it. She went from cognitive to a coma within 10 minutes, and she never regained that. But it was quite a dramatic process to see, and I had never seen that one so dramatic. Anemia, heart attack, asthma, lungs, those are all part of anoxia to the brain. Infections, meningitis, encephalitis, those are other issues that we have to deal with if there's some brain damage there. Medications also, antipsychotic drugs and medications, side effects from those. And you'll see those when you get into the dementia phases because the side effects cause a lot of irreversible brain damage to that area.